This is Dr. Daniel Paul with Easy Orthopedics, and today I'm going to answer the question, what causes hip bursitis? You may have hip bursitis if you notice you got pain on the side of your thigh, not really in your groin, but on the side of your thigh. Maybe it hurts after you walk on uneven surfaces for a while. Maybe you're waddling a little bit. Maybe you can't lie down on that side. If you have those things, you may have hip bursitis. So what causes it? Well, first you have to know what a bursa is. So bursitis is inflammation of a bursa. So what is a bursa? Bursa are these little fluid-filled sacs that normally they're not that big and they kind of help with gliding and friction. You have one behind your elbow, you have some in front of your knee, you have one in your shoulder, but you also have one on the side of your hip. Now that prevents the outside of your hip bone, called the greater trochanter, from rubbing on something called the IT band, which is this big thick band which runs along the whole length of the hip. Now, there's normally space between the greater trochanter and the IT band. If your abductors start to get weak, now abductors are the muscles that let you pull your hip, kind of away from your body. If those get weak, that IT band starts to rub on that greater trochanter, and there's a bursa there, and that bursa gets inflamed, and you end up getting pain in that area. The abductors keep your hips stable when you're walking. Now, most of the time, you're not really using them a whole lot if you're walking on flat surfaces, but if you're walking on uneven surfaces, you use them a lot. So if you get hip bursitis, it'll be worse after walking on uneven surfaces, because that taxes the abductors, and then it will start to rub more. And like I said, when people get it, it'll hurt on the side, it'll hurt when you lie down on it. So that's usually what causes hip bursitis. It's weak hip abductors. Now sometimes you can have a tear of one of the abductor muscles where they originate, which is also in the greater trochanter, but that's more rare. Most of the time, it really is hip bursitis. So how do you diagnose it? Most of the time, the diagnosis is pretty easy. It's pretty much just pushing on the side of your hip, and if it hurts, that's mostly the diagnosis for hip bursitis. It can show up, it's not going to show up on x-ray, it can show up on MRI, but you definitely don't need an MRI to go look for it. So you have hip bursitis. What do you do about it? Well, the first thing is you got to get those hip abductors strong again, which will create space between the greater trochanter and the IT band. So you could do hip abductor exercises, and also core strengthening exercises will help as well. You can do it on your home, but if it's pretty bad, then you may want to do a formal course of physical therapy. Also, what can help, and what I do fairly often, is I'll do a steroid injection to that area. Now, a steroid injection to the hip bursa usually clears the whole bursitis up and can sometimes completely cure it. It's not like injecting an arthritic knee joint. When you do that, it's just kind of a band-aid. The arthritis is still there. But in the case of bursal steroid injections, it can actually take care of it in its entirety. So you get the combination of a steroid injection and physical therapy. You'll usually do really well with this. You just got to make sure you keep those muscles strong, otherwise it may come back. Rarely will someone ever need hip bursal surgery. I mean, it's got to be a pretty bad case where you have to remove the hip bursa. Rarely ever done. Usually don't need it. So to conclude, if you have pain on the side of your hip, hurts when you walk on uneven surfaces, you're waddling around, probably have hip bursitis. What do you do about it? You do some exercises, or if you want, get a steroid injection and do some formal physical therapy. I hope that I answered all of your questions. If you have any questions that I didn't answer, feel free to post them in the comments below and I'll respond. If you like my content, then please subscribe to my video channel, and I hope you enjoyed this video.